Have you ever wondered why your energy levels seem to have a mind of their own? Or maybe it's your mood that seems to fluctuate all on its own. This could be due to your thyroid, a small gland responsible for several different functions throughout your body. The thyroid is a butterfly-shaped gland located in the lower part of the neck. It measures approximately 5 centimeters by 5 centimeters in size, with an average weight of 20 to 30 grams in adults. The thyroid is composed of 2 lobes which are connected by a structure in the center. As a part of the endocrine system, the primary function of the thyroid includes synthesizing hormones, specifically thyroid hormones located in the 2 lobes of the thyroid. By doing so, it is responsible for many of our bodily functions, including things such as growth and development, as well as regulating our basal metabolic rate, or BMR. Now you might be wondering how this small gland could possibly affect our energy levels and mood. In order to explain this, let's take a look at 2 patients currently experiencing symptoms that have been affecting them greatly.
Hi everyone, my name is Mehreen. I've been experiencing some weird symptoms lately, and I'm not sure why. For example, I've had a lot more energy than before, and I've also been losing weight. Sometimes I also experience tremors, shortness of breath, anxiety, insomnia, and nausea.
Hi, my name is Amal. Recently, I've experienced a slowed metabolism, tiredness, and weight gain. I also feel like I have an impaired memory, mood impairment, muscle weakness, sensitivity to cold, and deterioration of my kidney function.
Upon going to the doctor, both Mehreen and Amal had blood tests done where the thyroid hormone levels were checked. Based off this, the doctors diagnosed Mehreen with hyperthyroidism and Amal with hypothyroidism. Hyperthyroidism is characterized by an increase of thyroid hormone production, while hypothyroidism, on the other hand, is the opposite and is caused by a deficiency of the thyroid hormone which slows down bodily functions. Both disorders affect almost 4 to 5% of the US population, making them some of the most common endocrine system disorders. Now, let's go back to both patients as they explain what may cause hyperthyroidism as well as hypothyroidism.
In my case, the doctor told me that my hyperthyroidism was caused by thyroid nodules, which are lumps on my thyroid gland that can become overactive and start producing too much thyroid hormone. However, the doctor also explained that other causes can include things like Graves' disease, which is an autoimmune disorder that attacks the thyroid gland. Another cause is thyroiditis, which is the inflammation of the thyroid gland that causes hormones to leak into the bloodstream and create symptoms of hyperthyroidism. An overload of iodine from medicines and other sources, or too much thyroid hormone medicine used to treat hypothyroidism, can also cause thyroid hormone levels to rise above the normal range. Lastly, benign tumors on the pituitary gland can also cause hyperthyroidism, but they're rare.
For me, I was told that Hashimoto's disease is what caused me to have hypothyroidism. It's an autoimmune disorder that attacks the thyroid gland and decreases thyroid hormone production. When I went home, I decided to search up some other causes so that I could also inform my friends and family. I found out that other causes of hypothyroidism can include things such as congenital hypothyroidism, which is when one is born with a thyroid gland that is not fully developed or functional, which leads to a deficiency of the thyroid hormone. As mentioned by Mehreen, thyroiditis causes thyroid hormone to leak into the bloodstream and creates temporary symptoms of hyperthyroidism. However, after a while, the gland can become underactive in hormone production and lead to hypothyroidism. Furthermore, radioactive iodine treatment used for hyperthyroidism gradually destroys thyroid cells and leads to hypothyroidism. Lastly, medicines for the heart, bipolar disorder, or cancer can interfere with thyroid hormone production and lead to hypothyroidism.
Now that we have learned from 2 individuals firsthand about hyper and hypothyroidism, let's also learn about how these 2 conditions can be treated.
Hello, I'm an endocrinologist assistant, which means I work with doctors to treat patients with all types of endocrine system disorders, including both hyperthyroidism and hypothyroidism. As you already know, these are some of the most common endocrine system disorders. However, they both can be treated. What I usually see as an effective treatment towards thyroid issues like hypothyroidism and hyperthyroidism requires an approach of both medicine and changes to lifestyle. Combining the 2 can help adequately control any symptoms like lower energy levels. However, treatment with medicine and lifestyle changes can also vary on a case-by-case basis. In cases of hypothyroidism, I usually see that treatment involves the use of levothyroxine, LT4. LT4 is generally taken orally every day in the form of a pill. LT4 therapy is normally able to resolve many health issues that stem from hypothyroidism, like tiredness and a slow metabolism, therefore returning the health of an individual to an optimum level. In cases of hyperthyroidism, I usually see that treatment involves the use of medicine as well, but lifestyle changes can make a difference too. Anti-thyroid drugs, ATDs, radioactive iodine therapy, and surgery are some of the main treatment options available. ATDs are usually only a temporary solution and are often combined with radioactive iodine therapy or surgery. As an endocrinologist assistant, I noticed that those with hyperthyroidism are recommended to consume enough calcium, which they can get from a variety of foods like cheese, yogurt, milk, and dark green vegetables. Apart from calcium, individuals should also watch their iodine intake and try to reduce it. Optimizing the intake of iodine is important for good thyroid health and can help with mild hyperthyroidism. Consistent forms of cardiovascular exercise may also reduce the severity of symptoms and give you the energy that you are missing. Keeping a regular sleep schedule and sleeping 7 to 8 hours every day lowers the risk of thyroid issues. Furthermore, controlling stress levels can also help to possibly alleviate any symptoms. These lifestyle changes are essential for a healthy thyroid and for the energy levels that you are missing in your everyday life. To summarize, patients with hypothyroidism should consider LT4 as their treatment, while those with hyperthyroidism should take a combined approach of ATDs, radioactive iodine therapy, or surgery. Lifestyle changes are also recommended for those with hyperthyroidism, which include increasing calcium intake to improve bone density, controlling iodine intake, exercising, sleeping well, and controlling stress levels. Remember, maintaining good thyroid health is crucial for your mood and energy levels due to the hormones it produces. Imbalances in these hormone levels can cause negative effects, which thyroid treatment can help reverse. However, it is also important to understand that each case is different, and treatment depends on the specific patient. For any symptoms, please seek the help of an actual medical professional as soon as possible.
Well, that brings us to the end. This video was focused on shedding light on a gland that is often overlooked but has a big impact in our day-to-day functioning. I hope that you now know about the complications that can arise from the thyroid, including hyper and hypothyroidism, and how to identify the signs and symptoms of either condition so that you can take immediate action against it. Remember, your small thyroid gland plays a big role in your energy and mood, so make sure to understand it, take care of it, and stay energized.